Okay, welcome everybody. I also just want to say like a big thank you for joining us today, but also your commitment to learning by being the diehards that stay here until the very end of the day, 5:15. So let's start the session off by giving ourselves a round of applause for our commitment. Okay. Today's session is Operationalizing Shelter Data. I'll be the moderator for today. My name is Grant Martin. I am the network coordinator for the Canadian Shelter Transformation Network.
Woo! Woo! Wake up.
Chris is my unofficial hype man. So I do want to just take a moment to introduce our presenters, Chris and Kevin. So Chris Gorman and Kevin Webb are two sector disruptors who've turned data, strategy, and a love of the outdoors into full-time missions and occasional comedy routines. Chris, a senior associate at Org Code Consulting, is a public speaking data nerd with a beard so commanding it once got mistaken for a keynote speaker. With 25 years in the nonprofit sector across Canada and the US, he survived more strategic pivots than most people survive family group chats. He's the self-declared HIFIS champion of the world, probably because no one wants that title. And he believes in outcomes over tasks, data over drama, and being kinder than necessary, even when someone says, let's circle back for the third time in the meeting. Kevin Webb, the Director of Emergency Shelter and Housing at the Calgary Drop-In Center, is an advocate, a data nerd, and a champion of using information to drive real change. His beard may be shorter than Chris's, but his ability to cut through nonsense is legendary. Kevin leads shelter operations, housing programs, and mixed market residential buildings with the kind of precision that makes you wonder if he's secretly powered by dashboards and quiet determination. He's known for building systems that actually work and collaborating across sectors with the kind of calm that makes others question their caffeine intake. I'm proud to join them as co-founders of the Secret Society of the Imposter Syndrome Club. That's a highly exclusive organization where the membership requirements include being excellent at your job while constantly wondering if someone thinks you are just winging it. Anybody relate to that? Yeah. So they believe the status quo is not good enough when people's lives are at stake. They champion housing over Band-Aids, dignity over detours, and the radical idea that listening to people is more effective than arguing over whose spreadsheet has more tabs. Whether they're presenting at conferences, leading teams, or pretending to relax outdoors while secretly thinking about system design, Chris and Kevin bring humor, humility, and a relentless drive to make homelessness rare, brief, and non-recurring. Just don't ask them to share a secret fishing spot or a beard grooming kit. I don't have either. All right, so let's welcome Chris and Kevin.
To lower this. That was quite an introduction. So thank you. I like Grant. One, I am just so impressed that the data sessions at this conference seem to be the busiest sessions this year. So like we're cool again. I think that's pretty awesome. So is this the clicker here?
Yep.
Kevin and I are going to present this more as a united front and a team than two separate presentations. And so I'll get started, but we'll probably jump in a bunch together. And the purpose today of us all being here is really to demonstrate how emergency shelters can evolve beyond traditional metrics. And so I assume because you came to a session at the end of the day on operationalizing shelter data that you're kind of into this topic. So we're in the right room. Everybody here is cool now. And so as we get, you're going to have to introduce this, Kevin.
Okay. Hi, everyone. If you can just do us a favor, pull out your phones, scan this QR code. There's a quick survey that we'll ask you to do. it will actually be part of our presentation going on about the actual listening to guests of our shelter. I love that there's like giggling and all this type of thing. So
I also think that like this is a really good social experiment to prove that if you can do this, you can also do HIFIS or whatever data management system you're using. So there's no excuses really. We can't move on until the giggling stops, I suppose. Okay. Are we good? So, I want to start really by saying, and this comes very sincerely from both Kevin and I. I think we both love our jobs immensely. I feel extremely fortunate to get to do the job that I do at OrgCode and visit different shelters across the country, meet with shelter staff, see how things are working, talk to guests and participants of shelters. Kevin obviously has a really important job at a really important shelter. And while we're going to be talking about data today, we want to be very, very clear and intentional that while we do dork out on data often, we never, ever forget that when we're talking about data, we're not just talking about numbers, and we are very clear that this is people's lives and their stories. We are privileged to get to experience part of that with them, but we don't, as lighthearted as this can be sometimes, this presentation, we know it's not just numbers. So when we talk about data, we know it's real lives and real stories. And while the presentation also isn't focused specifically on the model of housing-focused shelters, it's impossible to really dive into how do we operationalize shelter data differently without touching on that model. And so at its core, an oversimplified definition or explanation is housing-focused shelters are solutions-based and short-term. They are clear that philosophically and operationally, housing-focused shelters are part of a process towards permanent housing and not a destination in themselves. And so every policy, procedure, and every data point points to how do we increase access to permanent, lasting housing solutions. In a housing-focused shelter, housing isn't just one of the important measurements. It's really the driving force behind all activities. And in practice, that means we start on day one. So housing starts on day one with every participant, every conversation, every activity is geared towards that. And it's not a model where it's owned by a couple people working in shelter. It is every person from board members to kitchen staff to leadership to overnight shelter staff to your custodial staff, everyone working with that shared clarity of purpose that moving people towards permanent housing outcomes is our goal. And if we're going to do that, if we're really focused on that goal, sometimes we have to look inwardly at the processes, the policies that we develop and operationalize to see, are there things that we're doing that are actually getting in the way from achieving that goal? So becoming a housing-focused shelter, following that true model, it does not happen overnight. Would you agree, Kevin?
I would completely agree. We started our transformation at the Drop-In Center in 2018, and it's continually evolving. We're constantly in that learning mode.
It's culture change, right? And so in the end, what we're really looking for is shared understanding, shared language, and have that permeate through every level of the shelter. And that cannot happen overnight. It doesn't happen through 1 or 2 trainings. It doesn't happen from a couple people owning that. It has to be culture change truly permeating throughout the entire shelter. And so over on the far side here, we have leadership alignment. What I mean by that is that leaders, they set the focus of what the shelter or any organization is looking towards. And so what we're looking for is being data curious, really diving into the data points that drive solutions at shelter, and finding ways to use that every day in every aspect of the shelter. I think even when we're curious about data and we're folding that into our approach, if we're really focused on housing focused data, as we fold that into our approach, inevitably we're getting better and changing policies towards housing focused solutions, because that's the data we're talking about every day. If we spend all of our time talking about occupancy, the things that we end up changing at shelter is how to improve bed count and occupancy. But when we really focus on housing outcomes and have that be our focus, that's where we see policies on that end start to change. In the middle, team practice, that's where staff make housing part of everyday practice. So every conversation, every team huddle, every supervision meeting, it's all aligning towards how do we focus on housing solutions for folks. Systems feedback really is like, if we think about the data that we talk about, the data that we report out, how do we align that to be greater focus on those housing solutions? So I think what we've done really well over the years is capture some remarkably good data at shelter. But the story we need from shelter is not necessarily who's entering and flowing into shelter, but how are people flowing through shelter towards home. And so I think, who here works in shelter? Like currently works in shelter? Awesome. That's way more than I expected. Shelters have done a remarkably good job over the years at being at capturing data. So I think as a sector, as a country, what we know about homelessness has been driven by the great work that shelters have done. So we understand the scope and scale of homelessness in communities way more because of the work that shelters have done prioritizing data. So we know, the demographics of people accessing shelter. We know why folks access shelter. We know what drives people into the experience of homelessness different. We know who's experiencing homelessness for the first time differently. We know because shelters do such a good job there that we have an emerging crisis over seniors experiencing homelessness for the first time. We know all of this. But what we've done, and we have to keep learning from that, shelters have primarily focused that data-driven work on who's entering shelter. And so we have to find a way to do that same quality and valuing of data on the outflow side. So how do we measure who's leaving shelter as well as we do who's accessing and why? And I'll say in the only way, like I cannot be succinct in storytelling, but I'll do my best. Years ago, before I joined Org Code, I was a data lead for a province here in Canada. And so we had an incredibly strong, it probably still is incredibly strong, shelter network that all used HIFIS on a daily basis, like remarkably well. So I knew every day by about 11 o'clock in the morning that I could have a very accurate and real-time picture of what shelter looked like the night before. So every shelter in the province actively used HIFIS every day and valued it. I could tell you who was there, why they were there, how long they were there. I could tell that story really well. What I could never tell was who left shelter and why. And so who here uses HIFIS? I love HIFIS.
World champion.
World champion. Did so much work refining that reasons for service when people get booked into shelter. And we never did that same level of work at figuring out why people are being booked out of shelter. And so I started getting questions of who's being housed, which makes sense as far as the question to get asked. And all I could really say, all the data that I had was 98% of people leaving shelter is whereabouts unknown. And that's not a usable, does anybody, does that resemble your data at all? It's not, it's data. It's nothing we can learn from. And so what we do know is that shelters have the capacity and the will to track really great data. We just have to shift that focus so that we're looking at why people are leaving shelter, who's not leaving shelter, and what can we do differently to help speed that up. So this is not all of them, but these are core data points that really help measure what matters when we think about that outflow side of it. So exits to permanent housing. I'll ask this super easy question. Anybody can answer. I'm assuming it's probably the same answer for most people. When you work at shelter, what is the question you get asked the most as far as your data? Yeah. How full are you? Yeah. It's always, how full are you? Are you, and so most people can say that. They know capacity numbers. Are we able to say who exited to permanent housing with the same confidence and clarity? I think it's easy to know why that one matters. Depending on which tool you're using, how you track it is a little bit different, but prioritizing that as a key data point changes your operation because that's what you're focused on increasing. The length of stay, one of the sessions earlier, somebody was talking about how they've been able to look at their length of stay and set really good stretch goals to reduce that. And so if we can measure who's leaving, how long people are staying, and then really dive into how do we decrease that length of stay. Who here knows their average length of stay data right now? Is it, well, but that's a good baseline, right? Yeah. What might it be?
About 12 days.
What? Get out of here, that's awesome. Yeah. 12 days? That's, okay, I was thinking 9 months, but I like 12 days. Yeah. Does anybody here think that's absolutely your stretch goal in 3 years to get to 12 days? Yeah.
Yes.
Yeah. But if we measure it, we can learn from it. And if we learn from it, we can adapt how we approach it. And if we do that, we can start to see reductions there, right? Returns from shelter is another key data point. It is I'm not going to pretend I know a perfect way to measure returns from shelter. What I will say is that I think what's really important in returns from shelter is focusing in on who's returning after being housed, not specifically who's returning to shelter after going whereabouts unknown or exiting your shelter, but who's coming back after being housed and what can we learn from that? Of course, we can learn from all data points, but I think that's what we really need to zone in on right now. Housing plan progression. So like, what are we looking at internally? Are those housing plans that we're creating with all of our participants, are they being actioned and moved forward? And what can we learn from where those gaps are, or even why they're not being progressed? Like, have we identified that maybe we've created something where our staff are too busy to focus on housing? And if that's the case, what do we need to do to realign how our shelter's operating so that we can be mission driven on housing?
Chris, if I could, with the housing plans as well, not only the progression, but what can we learn by analyzing the data of housing plans for the next person that comes along? So if we've had multiple areas that have worked really well with one person, maybe we can use that same data and that same approach for client B down the road. So not just the progression, but using it to drive programming.
Yeah. And then diversion, everybody's favorite topic, but are we prioritizing diversion as a true success? Like, if we can keep people from not accessing, but needing to stay at our shelter, like, how are we measuring that? How are we learning from it? And how are we prioritizing it? And then I'm not going to speak much about guest feedback because this is Kevin's expertise here. But we cannot do all of this work. We cannot be focused on numbers and not ask the most important people in the equation how it's going, what are we not doing well, and what should we do more of? And if we're going to ask those questions, we better do something with the responses that we're given. So, one of the things that I really love about the role that I get to do at OraCode, and again, like, I've been at so many shelters now over the last couple of years, doing, site reviews, all kinds of work with hundreds and hundreds of shelter staff. And every time, one of the things we do is do an anonymous survey with those staff. And we get really good feedback. And we use it. So I want to be really clear. If you're a shelter that we've ever worked with and we've given you an anonymous survey, that data does not just fade away to nothing. We use that for every next shelter that we go to, and we try to really listen to those answers to create a little bit of a better approach. So what we hear consistently on the question of what do you need more of in order to do your job better, it's usually like a list of 10 things that people rank. Shockingly, and I think this is highly appropriate, shelter staff need more pay. That's not a surprise. It's an absolute necessity. What is a surprise is it's never even in the top 5 in that list. So what is consistently, I think it should be in the top 5, but people never seem to put that as their own top 5. What is consistently there in the top 3 is people want more and better training. They want clarity of purpose of what their role is and how that role fits into their organization. And they want to be recognized for doing the work they're doing. And the next one it's always these ones. They want people to move on from shelter. Nobody seems to enter this work weirdly, trying to do the same thing with the same people every day. And so what seems to drive burnout is working incredibly hard and not seeing solutions. So we need to give people better training, recognize them for that great work they're doing, and help drive solutions.
One of the things on with staff data for staff that we've incorporated is actually data visualization walls. So our shelter data, things around occupancy and housing outcomes and health service outcomes, we actually now post in our shelter so that it doesn't go into that black hole of data when we're asking people to continue to enter stuff. They actually get to see it and see their impact. So we have dashboards, but we actually literally just have a wall in the boardroom where they have their meetings. And every month we go up and change it, put the new data up. We do focus groups with the staff to say, okay, what do you want to see next month? If it wants to change, then they want to do a deeper dive into demographics, we'll do that. So really showing that the data that they're entering every day is actually being used.
And I think if you think about that, like there's so many layers to be able to get to that point. One, it means you're actually consistently having staff meetings. So you're talking to people, you're asking questions, and you're folding back the responses into the way that you're creating policy and process. It's really hard to do that if you never talk to your actual staff. So when we talk about operationalizing shelter data, those are sort of the outcome measurements. Those are the things that we want to measure to prove that we are being housing focused and seeing greater results. But the daily rhythm of how we get there is also really important. So that day one meeting, and it can mean lots of different things, but like early on, are we meeting with folks and setting that tone and expectation that our mission here is to help you find safe and appropriate permanent housing every day? That's our mission. And if we set that tone and culture from the beginning, right in that day one meeting, then we don't have to do that down the road and start to reframe why we're here. It's built in from the jump. The 72-hour plan, are we consistently, after folks have had a couple days here, starting to create actual housing plans for folks? So not just the conversation around this is why we exist, but this is how we exist. The daily review. So are we looking at those plans to make sure that nobody's falling through the cracks? It is, it makes sense that it happens, but it still kind of sucks that it happens, that folks who are quiet tend to go unnoticed and end up being the folks that stay at shelter far longer. We tend to work well with the people who are really good at asking us for help, and the people who are quieter about that but still need the same level of help, they tend to sit in shelter longer. So if we're doing this daily review and we're folding in like this approach of every couple weeks, we're looking to see which plans aren't moving forward for whatever various reason, then we can start to make sure that nobody's falling through the cracks and we're not purposefully designing gaps in our system that some people get housed and others don't. And so if we do all of this consistently and fold it into our approach and make this the core of the way that we operate, and we have these weekly checks and a really strategic, and again, have that lens of being housing focused, we can see those outcomes start to change, but we can't say we're housing focused and really looking at those outcomes differently if we don't bake it into the cake in how we operate. This is not a real dashboard. This is a very fake dashboard that I made specifically for this slide. To prove that dashboards are really easy to make if you need to do them. Not good ones like Kevin's, but mine on Infogram, which is a free site that you can use to make a dashboard in about 3 minutes. But if you want to drive this internally in your organization, the one thing, this is going to sound dumb to people who do this work and are clearly into data, it is really hard to get people to focus and value data if you don't show them where it goes. And so if we can use dashboards strategically, yes, to show our outcomes, that is remarkably important, but internally to show our process, it is equally important. So we can have a dashboard that shows, are we hitting our targets on those daily meetings, on our plans? How many folks aren't having a plan progress? And so if we do this, and this is what we base meetings around, it changes the purpose of so many roles within shelter, right? So if this is our focus of our meeting, it's the focus of our day. And if it's the focus of our day, it's why our shelter exists. So I'm not going to jump to your slide. I'll say one of the other questions that I always ask in a survey before we move to the next slide is, it's usually the last question, and I always ask it in the same way, which is like, what is the point of your job? And I get remarkably different answers in the same shelters and all across the country. And so I think if we're doing things like this really well and diving in and focusing on how we operationalize data and focus it towards housing, then people's answers to that question would be different. So right now, I see a lot of responses of our job is to help keep people alive, and that is incredibly important. If we're looking at this every day, our job becomes how to keep people or get people housed and stay housed. Kevin, would you like to talk about guest feedback?
I certainly would. Thanks.
Yeah.
Show of hands, who knows the Calgary Drop-In Center? Okay, another show of hands. Whose point in time count is 1,000 people or less? I can fit your entire point in time count in our shelter. So just want to say it that way to really paint the picture of how big our shelter is. So Calgary Drop-In Center is a housing-focused, recovery-oriented, trauma-informed emergency shelter. Really want to talk about that because we can see up to about 1,000 people a night. Right now we're sitting around 700, and really want to go into the leveraging the timely feedback, specifically this feedback from guests of our shelter and how we operationalize it to actually better our services. So one of the things that I heard a long time ago when we started on this journey was that we need to stop building programs and finding the people, that we need to find the people and build the programs. And that's where the data comes in, is so important. So with the feedback, I'm gonna maybe jump ahead here, but we wanted to look at how we get feedback from guests at the DI. We really wanted to do it because we knew that it was going to continue to build trust. It was going to allow people to have a say in where they are and the programming that we have. It's going to inform our development of our programs and also continuously have us in a quality improvement mindset, which isn't something always in shelters that we think about because we're always in that crisis response. But that quality improvement mindset has really helped us move things forward. So how we used to receive feedback, we've tried a number of different things. So we did, frontline staff went around and did a survey twice a year, and they'd sit down with an individual and ask some questions about our services. But we started to see some drawbacks and some cons to it. There's pros to it too, right? That we're getting to engage with guests. Staff get to hear exactly what guests are saying. Be honest with you, like we have 1,000-person shelter, so it was a very challenging thing for us to do. It was very time consuming. As I talk about how we went through and what we did, I really want to emphasize that It's not about how you do it. It's the importance that you do it. So some of the cons that we found with this in our organization was it created a power dynamic when we're asking questions. We had also response biases where staff would possibly think something didn't make them sound great, so it would change. A long list of things, but I think one of the biggest ones was in an average month, we can see about 2,000 unique individuals walk through our doors. And a point in time is not getting us the information that we need to do proper quality improvement, because if I do a survey today and 6 months from now do it again, I'm not seeing the progression change in the service delivery that we've put through. So what we decided to go with is a self-serve kiosk, an anonymous feedback loop for guests to give us their feedback on our services. We've tried a few different ways within the surveys to really capture data, and I think we're in a good place right now. But what we've started to see was that it was anonymous, and we were getting a ton more feedback than we thought when we started the process of using the feedback surveys. Also, the reason that we chose the company we did, which was Pulse for Good, was that it was incredibly accessible. It has multiple languages. You guys saw a picture. Did the pictures work in your survey you did? Okay. We've got to really be trauma informed because we removed that power dynamic. We removed the biases. We allow people to really do what they want, when they want. It's open it's there 24 hours a day, 7 days a week. And then it was a real easy thing for us to use as users with proper dashboards and everything. So if we look at some of the information that we've been able to receive, so this is actually from our surveys. The first one is what was it about this program that motivated you to join? This was a really, really interesting situation. So we opened a shelter recently, and it's an encampment response shelter where we partnered with outreach groups. And we said, you know what, like we always hear the thing that people don't come to shelters because there's not enough storage space and they have too much belongings. So we created this shelter that had more storage space and we broke down barriers. But interestingly enough, when we used the Pulse for Good surveys and we asked what brought you to the program, it actually wasn't more belongings or more storage space. It was actually that we also told them they were going to get immediate access to housing supports, and that we were collaborative with other organizations. So it really started to push us to look at how we do things differently. And it also pushed some of those standard terms that we always hear, right? Like outreach groups and other groups saying like people don't become because of storage. Well, we've kind of shown that if we can give them housing supports in that housing focused shelter model, that's actually what's going to bring them in. And then we've looked at things like, do you get enough food? So we ask questions, and we know in shelter that people don't get enough food. It's obviously, sometimes it's not as nutritious as it should be. But we actually decided to go one level deeper on this and ask what meal people don't get enough of. And the meal across the board was breakfast. So over the following months, we were able to set a benchmark and watch that breakfast number start to move more in line with lunch and dinner. So it really shows that improvement piece. But there's also the pieces around the free text feedback. So one of the free text things that we get a lot, and we categorize them and we try to go through them and make changes with them with quality improvement initiatives. But one was so simple that we never, as shelter operators, we walked by 1,000 times a day and never even considered, was that on our second floor dorm area style shelter, the curtains were really dirty. And we were like, okay, well, this is something we've like kind of walked by 1,000 times, went up and looked at them, and yeah, they were really, really dirty. So we just, in a day, we were able to remove them all and put different things in, right? So, but then we started to hear back from people, thank you, right? Thank you for doing that. Or
Thank you for listening.
thank you for listening to me, right? So all of this data that we collect through Pulse for Good, much like we do with our staff, our shelter data where we share it with our staff, we actually share this information back with the guests as well. So they see that their feedback is happening. We close that loop and say, hey, your feedback has actually driven this quality improvement initiative. Have you seen a change in it? So we continue to monitor and change the Pulse for Good. I'm gonna probably break something here. So this is the survey you guys just took. So this is to show you what we get on a daily basis. I mean, at any point, I can pull this information up and get that immediate feedback from the guests. Oh, okay.
Yeah.
I was totally confident that number 1 on the how confident we would stay on topic was going to be a lot higher. So 10 I'm a little shocked on. Everyone wants a dragon. Is that because the new I Trained Your Dragon movie came out? No, just like the dragon. It's funny, the data, I was at a Data Makes a Difference conference and there was buttons for that and I just love that. Looks like everyone's enjoying Montreal.
Oh, that's the most important question.
It is.
Yeah.
Chris and I are Leaf fans, so that's why we put it in there. I have a data person at the DI, Emily, who was like horrible suggestions, like you're going to put the PWHL in there for me, so that got put in there. But it's just to really show how quick we can actually get the data and the information to drive it forward. And you can see I can switch things up into pie charts, into counts. All of the information is downloadable. One of the things that I love about this so much is that when we pull the raw data, it actually shows what language it was translated from, so that we can adjust our conversations and everything. We have buttons at the DI that staff wear that say hello in different languages. So the Pulse for Good has worked incredibly well for us as a platform for the feedback. But I do want to talk about another way that we've used this as an anonymous feedback loop is actually for staff feedback. So we've created it to, did that work? Yeah. How many people here that work in shelters hear the term, it is not safe? Okay, I was hearing that. In shelter, from shelter staff.
It's not safe.
Yeah, and shelter staff were saying that complexities are getting different and that working there isn't always safe. So we did a staff survey on safety. Shockingly, it came back dramatically higher than what we were hearing. So through that, though, we were actually able to do a number of quality improvement initiatives to help elevate that number for this year when we did the survey, and we saw an increase in the percentages. But giving the staff that anonymous feedback loop helped to really inform our leadership decisions. So how we use the data, and I think that this is for the guest data as well as any data that you're using in shelter, is the 4 A's, the awareness, adjustment, action, and accountability. So the awareness is, getting that guest feedback, be it through a kiosk, be it through surveys, be it an advisory council, whatever it is that you use in your shelter. And then looking at the key questions of that is, what are guests saying? Are there recurring themes or concerns? And what's working well? And what's causing frustration? From there, going to the adjustment stage. This is where we're really going to analyze the data and look at how we can do things. The action is really about, we're going to make a change, but we're going to communicate the change. We're going to communicate it with staff. We're going to communicate it with guests. update signage, all of that type of thing to show that we're closing that loop. We're bringing the circle all the way around. And then the accountability where we're going to continue to monitor it on an ongoing basis and not just stop. This is what I, 99% of the time, am completely guilty of. And I wanted to do this to show the importance of that adjustment stage when we're talking about data. I will hear something and be like, oh my God, I got to go change it, and run out and try to do the action to change it without actually taking the time to truly analyze the feedback. One of the things that we've done, because we're fortunate with the size of our organization, is I actually have one part-time staff whose job it is to just analyze our data. It removes my personal bias. It removes my bias from other staff. Emily has worked in the field for a long time, but she focuses in on that adjustment stage for us to remove that. So just the thing when we're talking about data is to really remember that adjustment stage, not jumping right to action.
Oh no, don't skip through all of them. We're gonna play a game.
Oh yeah.
Now you know the answer. So go to the first one. So this is Kevin's data from the DI.
I have a question though.
Yeah.
So we were reviewing this presentation and someone said, because we have the very catchy tagline of drop it like it's hot. And we were told that we were supposed to drop it like it's hot, and we don't know what that
means.
Yeah.
I don't know what it is. Yeah. Oh my! I can't do that. I barely get my socks on.
Yeah, I'm like 51. I'm not doing that.
Oh, well, that was mean.
Yeah.
Yeah. So 82%, and I think like these data points to me are really exciting, and especially once you know the size and the scale of the drop-in center and the amount of work that they're doing. So 82%, it's the number of shelter users since January that have been housed in independent housing. Yeah. So the next one, 331 people have been housed since January. 82% of those into independent housing. That is a remarkable number of people moving towards permanent housing solutions. And it is not what community members see or think when they see shelter. All they see is how busy shelters are. We do not report this part nearly well enough. That's 331 people who got housed. Good job.
Thanks. Independent, just for us and our terminology, is individuals have signed an independent lease in community with no rental supplements, no social supports, anything, and are maintaining their housing. Next one.
Yeah. 252 people diverted. That is a huge number of folks who did not need to stay in shelter. Allows us to focus on the other population and really dive in and do the work for people who absolutely need it. But those are huge numbers. Then the last one, average days from opening that housing plan to somebody moving into it. It's not 12 days.
Yeah, thanks.
Yeah. But 39 days is remarkably impressive. When, again, you think about the size of that operation, the first time I drove to the drop-in center, I was struck by the fact that there's a sign on the highway directing you to the drop-in center. It's a big shelter. And still, with the volume of people in there, they're able to move, on average, people into permanent housing solutions in 39 days. And it's not by accident, it's by purposeful leadership, focusing in that and having everybody that works at that shelter have that as their goal.
yes, we are a large emergency shelter, but I can't stress enough that this work, the data, the housing focused shelter does not matter what size shelter you are. I think I saw Jess in the back there, might have stepped out, but we're working with, we partner with the shelter in Canmore, Alberta, that has 9 beds. That's a data-driven housing focused shelter. So it makes no difference the size. The data is what's going to drive these type of outcomes.
And I think this slide, I think, is just incredibly important. So one, we don't want to present this data as a end point, but as a proof point that when we dive in and focus on those 4 A's, as Kevin mentioned, we can see progress. And so last year, the drop-in center, on average, like they saw 22% of their guests were Indigenous people. 12% of people being moved into housing were Indigenous people. They looked at that and said, it is not good enough. And they made changes and learned from it and adapted their behavior and their approach and increased that 4% in the span of a year. They're not done. They're going to keep looking at that. But data can drive equity for folks in shelter who do not get that otherwise. And so I think, to me, of all the data points, and I love all the data points from the drop-in, this is incredibly powerful, because if we don't do this, if we're not diving in, we are neglecting people that need our services in a better way. So great job, drop-in center, on that one. So key takeaways, again, like overall, I love data. Yes, I'm not a big fan of data that's not used. And so if we're just going to spew out data points and not make changes, it's just talking points. They don't matter. So do everything you possibly can to learn what's happening in your shelter, who it's happening for, who it's not happening for, how we can improve all of that, and then make the change and measure how that's working. But I think if we just get into this idea of like data matters, yes, data matters, but it matters because of how we use it.
Like at the Calgary Drop-In Center, when we started going down the road of data, Chris talked earlier about the important number that everyone wants to know is how full we are. We've advocated and pushed so far that because what we did with our funders is we started giving them our housing data. Now all shelters in Alberta have to actually report their shelter data monthly. So there are ways to get that into the funder's ear by just being a pest.
Yeah. Yeah. You're asking the wrong question.
Yeah.
How do we do, Grant?
You're ahead of schedule.
That's never happened once
No.
in our lives.
So I'll
You guys
just
can riff if you want for a bit, or
some key takeaways for the guest feedback is that it's about doing it. It's not about what process you use or anything like that, but we've found that the continuous feedback helps to drive quality improvement better than point in time. And really remember that the nothing about us without us.
And I think it's just like, again, we've proved, because we know so much about the experience of homelessness across the country, because shelters have done such remarkably good work with their data. So we know it can be done, and it can be done in shelters when that's probably not the reason why people got into shelter work. We can still focus and do that. We just have to pivot a little bit and focus on how do we use that data to get more people out of shelter, because we know we can learn and have learned from how people get into shelter.
And if you need help practicum students are awesome.
Yes.
All right. So thank you, Kevin and Chris. That was great. So let's give an applause. We're going to move in. We have time for questions and answers. So there is a microphone stand at the middle of the room. So if anybody does have a question, please feel free to walk up and use the mic.
Thank you for the presentation. Very relevant to my work and the work we're trying to do. I wanted to hone in a little bit on the technology selection or vendor selection process. How did you decide on this tool that you're using? How did you go about searching for tools to begin with? Because I feel like something like this is anonymous feedback tools, I think, are difficult to find.
Mm-hmm.
Yeah.
They have a booth here today. That's how I found Pulse for Good, was at the conference a couple of years ago. And then I'll be honest with you, the reason that we decided to go with Pulse for Good was that their mission aligned with our mission. They were a very values-driven organization. The system was built for the people that we work with. One of the things that I meant to mention or forgot to mention was that kiosk that's in our shelter of 600 people a night, low barrier shelter, is the only thing that's never been damaged or vandalized. So.
I think that's an important data point.
Yeah.
Yeah. I think that's everybody's concern, and probably a reason why a lot of people don't move forward with that is the assumption that it will get damaged.
Yeah, and the team from Pulse were like, no, it won't. And I'm like, okay, guys, you don't know our shelter.
Yeah.
And it's never been damaged. Part of their, I mean, you can talk to them about it, but part of their process and their membership is that, a kiosk gets broke, they just send me a new one.
Hi, George Clayton with the Canadian Urban Institute, and thanks for that presentation. I had a question about what your experience is when this data is given to funders and decision makers. And I'm wondering, it's not about how many people are in a shelter, but you still have to have the money to accommodate 700 to 1,000 people per night. Does it make a difference in terms of funding levels or the relative priority someone would put on this approach versus other approaches to homelessness? I'm just wondering what's been your experience when they have this data? Does anything change with that?
Oh, it's such a good question. I want to say yes, absolutely. Not always. I think if what we're focused on is occupancy data at shelter, what we tend to do is just continue to add shelter beds. And so it inevitably, if we're reporting on housing outcomes differently, that's where our focus is. So it's not the responsibility of shelters to ensure that everybody that walks through the door is housed, right? It's the responsibility of shelters to ensure that everybody that walks through the door is on a pathway to housing that makes sense for them. So shelters can house a lot of people. There's a lot of people that if we do this reporting and data work differently and better, we'll get connected to other services that they need. And so I do think it's not immediate, but there are shelters are not cheap. And so if we can show the cost saving of getting the people who we can move through quickly out and then focus on those pathways for other people, I do think the funders can see that differently. But as somebody who had to report this data to a premier on a biweekly basis for a couple years, it's not the data that they wanted. And so I had to keep giving it to them and say, this is the data you actually want. This is what you need to focus on. And it's not what community members are asking for, but I know it's what we need to look at. it's culture change on all levels.
And
They want, they don't want shelters in their backyard typically. But the idea of like, the conversation is always around how busy a shelter is, not how effective a shelter is.
And I think when we talk about community, you'll find a lot of the data points that people like to see, and it's the nice and warm and fuzzy ones of like, I've served 690,000 meals this year. Well, who cares? Right? We actually ended homelessness for 500 people.
Yeah.
Right. So shifting that narrative. And then on the data, does it make a difference with the funders? As we've continued to push it over the years since 2018, our transformation, it's actually changed the funding model in Alberta, where we used to be funded per bed per night. We're now funded to operationalize housing-focused shelters.
Yeah, and I'd say the same for New Brunswick years ago, where we moved to a model where the province was purchasing outcomes instead of positions.
Mm-hmm.
It just took a while.
Hi, my name's Mark. I'm from Harvest House Atlantic in Moncton.
Woo!
Oh, Chris, you're making me blush, bro. All right. I just wanted to ask for Kevin, like your stats are absolutely nuts, bro. And I just want to know, like, do you have any hints or tips for breaking down those barriers to getting people housed? Because I find that we get them housing ready, we get them document ready, they're ready to go, but there's nowhere to put them.
Yeah. Getting the people into homes is always the most challenging. Like in Calgary, we have about a 1% vacancy rate, 1-bedroom apartment, it's anywhere between $1,200 to $1,700. We've really had to shift not only our own mindset around what housing is, but having the conversations with guests. So if I think, and this goes back a long way, right? When I first started in this industry in a Housing First program, I thought about housing is a 1-bedroom, 2-bedroom apartment. When I first moved out on my own in Toronto, I would have loved to have the loft apartment downtown on Bloor Street that I always wanted. But I had to start somewhere else, right? So I had to start with roommates or in a bachelor suite, and then I can slowly go to the other levels. So we've started to have those conversations with people about the fact that, housing is a process. I love today when Loretta Ross said that, it's the home. It's not an actual house, right? A house is a commodity. The home is what they make it. So that's been one big thing for us that has really, really helped. And then we really pushed our engagement with landlords, where we've done training for landlords. We'll go with a landlord and do like an RTA training, and we've done harm reduction training with landlords and trauma-informed care training. And we have one landlord that we work with that's a bit of a small rooming house. We've actually gone in and trained them on naloxone administration, right? So building those connections has been a big piece of it. And we actually did a social media post where we asked for landlords. And we said, look, like we don't have any rental supplements. We don't have anything. We're looking for apartments in this range. We're trying to get people to exit homelessness. Please email the landlord at thedi.ca. We were ambushed with people wanting to help. We never thought that something that simple was going to actually form us long-term landlords. So, yeah.
I think, Mark, also like this work is remarkably hard, right? And so like I'm amazed that people come back every day to shelter work, and like they should be applauded for that. But I think what happens is we forget that we have seen success stories. And so just, yes, it's so hard to find housing, but reminding your team that they've done it for lots of people already, and it will happen again. It's hard, but that it's it's sort of this approach of like, well, nothing seems to be changing, but when you look back, you see that like how many folks have you housed this year? 16 this month? That's impressive.
Yeah.
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 60. Yes. So, yeah. Yeah. So, of course, there's more that need housing, and there's more that will get housing. But if we're always just looking at this, like the issue is so big and we can't solve it all immediately right now for everybody, and we forget about the successes and the wins we've created, that's when I think burnout starts to happen and people start to lose hope. Losing hope in this work is dangerous.
Mm-hmm.
Can I offer something to that as well? So back in the spring, I was at the Built for Zero Canada Learning session, and the session that I was leading was actually about like, sure, coordinated access works, but there's other ways that people get housed. And I started the conversation by saying in a previous role that I was in, I was actually in charge of implementing coordinated access for our community. And I had to look at our local data every month of new people coming into homelessness, people exiting. And every month, when we looked at the local data, we saw that about 65 to 70% of people who were getting housed each month were getting housed in the private market, not in our social or community housing. From that group, more than half of them were being housed in the private market without being assigned to any type of housing program, which meant no case manager helping them, like housing-based case manager, no rent subsidy attached. They did it. And for me, I had to, like, as the person implementing coordinated access, I had to swallow a big humility pill, being like, holy smokes, my system sucks compared to people's own resourcefulness and resiliency. And so I could just end it there, or I could continue the conversation. And I started to do some targeted outreach to people from the by name data that got housed in previous months and said, how the heck did you do it? Right? We have all these resources, we're doing all these things, and you're somehow doing it without it and doing it better than the system that we designed locally. And that would have been a huge missed opportunity if I didn't do that, because I had that identifiable data and people were willing to share. And part of it was some folks said, yeah, I had to reassess what housing looked like for me. Maybe I started out thinking it was a 1-bedroom. And then when I saw that that wasn't coming to fruition, I had to adjust to maybe like sharing an apartment or a room for rent. And that was more, I thought that was at least better than being on the streets or in shelter until I got to something, the next step up from there. The other was relationships, right? So tapping, there's like, yeah, like I didn't want to, but eventually I started to tap into my social capital. And that proved to be more resourceful, leading to a better outcome than your system that you created, Grant. Because people were willing to help me because they knew me personally in a way that the system wasn't willing to do for me. So took that data and brought back all those tips and tricks from people actually, and as a way to like feed that information back to the system and the staff that worked in it to integrate those practices to get better success in housing outcomes. And it improved over time. And I will still say that, like, similar to shelter improvements, coordinated access improvements are only going to come if we ask the right questions and ask them to the right people to give us the best information.
And we did the same thing, I think, Grant. Like, after we started the process and we started seeing people get housed, we did some focus groups with people. And that's where it shifted my mindset around what housing is for individuals. The lack of housing, we talk about flow. I could go on a rant for the next 3 hours on how, we don't have flow in all of our systems. We create flow in shelters, but do we have the appropriate flow in coordinated access? Do we have the appropriate flow in affordable housing? A whole other topic, but having some of those conversations with your partners around, like, how can we create flow to move people through on a light way. But I have some really good tips and tricks that I can talk to you about.
Leon Baker from Harvest House in New Brunswick as well. And I just got to say, I love the work you're doing. Just recently, I had the opportunity to fly just over 5 hours from Moncton to Calgary. And I spent an afternoon in the Calgary DI, and it was really motivating to see what you do. And actually, it's the reason why I'm here today. In Pulse for Good, I've already had a conversation with them, and I'm advocating that we should have an all of our shelters in Moncton. I guess the question I have for you, so I'm fairly new into the sector within 2 years. I'm really looking at the amount of data, and I believe we need to make data-informed decisions. And then myself, I'm a data person, and as well, I've got somebody within my organization that one of you know, and she's a data geek. But how do you, my conundrum or my struggle sometimes is taking the data that's there, whether it be HIFIS, whether it be on the floor, and making that data real, relevant, and impactful to the stakeholders. Maybe give me a little bit. I know you said it's been 2018, you've been going through that transformation, but maybe give me a little bit of insight and guidance on, like, how did you walk through that process to get that endless data to where you have it today? Like that one slide you had with 86% and down the line, that's impactful. So maybe unpack that for me.
It was a very long and windy, bumpy road. We made a lot of mistakes along the way, but we relied on partnerships. Ian DeJong from WordCode helped guide us through our data as well as our transformation. And then, we connected with, people like our funders and even community partners and asked them questions around, like, what data would you want to see in things like our report to community or what we're sharing on social media and all of those things. So there was a bit of focus group at the beginning. And then when it comes to the operationalization of it, it was focusing in on those 5 things that Chris talked about. That's where we started, and knowing that there's multiple layers within those. So you can start at the 5, like return to shelter or how long a person stays. Like, for example, like how long a person stays in shelter, I can't track that, right? In Calgary, we have 5 shelters, no shared database. So I had to make a hard decision of, like, I can't track like the time in shelter because I don't know if the person's gone to another shelter, right? So we had to make a focused decision on that. We're going to track length of time in housing program, right? From like that 39 days. But it's not an easy path. I think my suggestion to everyone is like rely on some of the experts that are out there that do it, like Ian. Chris?
Well, again, love data. I think the most important question always is why. So why do we need that data point? And I think we've asked a lot of questions of people experiencing homelessness, and I don't know that we need all of that information from everybody all the time. And so if we can drill in on why does this data point matter? What are we going to do with it? Then we can build the value for the people doing frontline work, so that we can be trusting a little bit more of that data point being accurate. And again, I've never seen anybody use HIFIS really well who doesn't know why they're using HIFIS. And so, like, I think if we can really hone in on those data points that will make a change, and start there, that's the key these days. Like, there's a million things we can track. There's 5 things we need to start with.
A perfect example of that, and I get asked it all the time, is why is someone homeless? I don't ask that question because there's been 4 billion research projects done on it, and we know the reasons why, right? So it's not a question that we ask. Like, when it comes to guest information, it's like birth date, gender, ethnicity, your name if you want to give us the right name. Like, that's it. and then focusing more on the flow and the outcome over all of those other little pieces. We do one other piece of data collection, but it's a needs assessment for individuals. But it's not a needs assessment to know anything really about them. It's about the service. So it's things like, do you get are you prescribed medication? Yes. Are you taking it? No. Okay, well, we're going to connect you with our medical team. So the data has to be used as part of that path forward. Does that make sense?
Yeah. And I think there's so many just wonderful things about HIFIS. One of the brilliant things is how you set up a user to clarify their version of HIFIS or their view of it. So it's focused on what their role is. If everybody could see every module and thing that exists in HIFIS, nobody would use it because they'd be scared. And so this idea of let's focus people in on the things that matter for them and their role in this, and have that super clear what their role in the overall outcome means. And I think we can get to a place where we're at least telling a far more unified, purposeful story.
Yeah, our monthly data and outcomes report, it's literally 30 pages. And we're presently going through it to be okay, this is a data point that we've done nothing with, get rid of it. This is something that we want to dig further into, so we're going to look at that. Yeah.
Hi, I'm Deborah Lodge. I work for a small nonprofit in Nova Scotia. Thank you for your presentation. It was really interesting. I just have a kind of curiosity about something that you mentioned earlier, one of the statistics or the data that you're getting back on people that are returning to shelter. And Grant kind of alluded to a little bit of my question, which was really about coordinated access and housing support workers. And I'm wondering, those individuals that are coming back into shelter, are you seeing any correlation between those that have had a housing support worker and those that haven't, those that have done it on their own?
That's a dangerous question, Deborah.
Yeah.
I love it.
Okay. Deborah, this is a question that I actually love to answer, but it also can really piss off some of our partners. Our lowest return to shelter rate is actually independent housing. Our highest return to shelter rate is coordinated access. Now, I do have to say, we know because of being a housing focused shelter, and we spend so much time on the appropriate shelter or appropriate housing over it's quality over quantity, that we're putting the appropriate people into coordinated access. We know that through coordinated access that they have a lot more challenges, probably more trauma, probably addictions. So we're going to see a higher rate there. But the independent is our by far our lowest number. So
Thank you.
A super good question. Great answer. I think, that answer is true and also means a whole bunch of different things, right? So of course we should expect a higher housing retention rate for people who have less support needs. We should. So if we're doing that piece well, yes. Kevin said something years ago to me that I'll probably get it wrong, but I always say it always stuck with me. But for folks with complex and co-occurring needs that are have really high housing needs, sometimes it's 7 times that they return back to shelter before you find that permanent housing solution. So yes, I think there's not one magic fix in any of this. Coordinated access will inevitably, especially if we're focusing housing-focused shelter work, we'll focus on the folks who need more supports. So the likelihood of returning is
probably higher.
And like we don't in Calgary, we do an NSQ for people to get access into coordinated access and assessment. In a housing focused shelter, that's our last thing we do. We do not do the NSQ a second someone walks in the door, because we also feel that part of our work as a good system partner is to reduce that wait list by putting the appropriate people on it. So, yeah. Actually, the highest return to shelter rate that we have is low-income housing providers. Low-income housing providers that don't have wraparound supports. Yeah.
Did Deborah steal your question?
A little bit, yeah. But my name is Ian Stratton. I'm from Threshold Homes and Supports out of Kitchener, Ontario. My question was, so we're a supportive housing organization for individuals living with severe and persistent mental illness. My question was, when someone has returned from a supportive housing setting, has the information told you anything about what we can do on our end to better support those individuals so they don't, any sort of feedback that your guests have given you, that kind of thing?
Yes and no, but I think that often what we're dealing with in Calgary may be different than you're dealing with in Kitchener. My suggestion would be go to the shelters in Kitchener and ask them those questions, or even ask the individuals that aren't there. I find that, there's the institutionalization that happens in shelters, which is a big piece of it. There's often, I'm not known to hold things back, but there's often a lack of training in some of the supportive housing models. Is anyone from Calgary? Okay. So I teach the Residential Tenancy Act and Housing First for Calgary Homeless Foundation. Been doing it for 5 years. I ask every single time, who can tell me the principles of Housing First? I've never had a single person put their hand up and say yes. So if we're putting people into Housing First programs, but we're not training them on what the process is and what their supports are and how they're to do their work, it's inevitably not going to work for certain people. So, sorry, that was a little bit of a soapbox.
I think it's important.
Okay.
Is anybody hungry?
Is anyone tired?
Is anyone actually really like sad that there's another baseball game tonight that we have to watch? Like, it's too much. Just let us sleep for a night.
All right. Well, I think that's probably a great place to wrap up. So I just want to take a moment to thank Chris and Kevin, but thank all of you for your participation and your questions.